Great. Okay, so we've got quite a lot to get through today. So yeah, thank you. First of all, just want to say thank you very much to everybody for coming, for joining us today. We've got a really exciting day lined up for you. My name is Sophie. I am a community support manager here in the global team at Humanitarian OpenStreetMap team. And I also hosted our last COVID-19 mapping for resilience and COVID-19 response workshop webinar that happened a couple of months ago now. So it was only fitting that I hosted the next one. So here we are. And yeah, today we'll be presenting some of the work that HOT has been doing on COVID-19 response and resilience. And we'll be having talks from some of the awardees from our microgrant program. So yeah, we're looking forward to that. Before we get started, I just want to say that this webinar has been hosted and organised by the HOSM Humanitarian OpenStreetMap Community Working Group. If you are not already a member of the working group, then please join us. We convene every Tuesday. You can find us on HOT's Slack channel, hashtag community working group. And you can also email community@hotosm.org. I want to say a big welcome to our new members. We've had a couple of folks join us in the last couple of weeks. So thank you for joining us. And please, if you want to get involved, then please get in touch with us. Okay, so today we are going to be kind of going through 4 things. First of all, I'll give you a bit of a welcome and an introduction to HOT and the COVID-19 response that we've done so far. We'll talk about what the HOSM's community has achieved. We'll have talks from iLab Liberia, Public Lab Mongolia, and OSM Senegal. And then we're going to have an optional kind of 30-minute networking discussion session. So if you have time to join us for the final 30 minutes, so that's an additional 30 minutes, the last 30 of the 90-minute webinar, it would be really great for you to meet the community members, and we'll split you out into groups so that you can network, chat, and meet other people from across the world, because we've got a really diverse group of people here today from lots of different fabulous locations. So yeah, so please feel free to join us for that session at the end. So I'm going to talk a little bit about our response activities. So to meet the wide variety of needs and requests, the COVID-19 response team divided the overall response into essentially 3 main areas. So first of all, we looked at remote mapping, where we wanted to increase the available data for response partners and actors on the ground, and that this included working with lots of big partnering organizations, but also with working with local OSM communities to get parts of their communities mapped. Then we had the microgrants, which is what we'll talk about a bit later. And we have 3 projects presenting from that program. And then we also did partner outreach and support. So the objective of that was to assess the humanitarian community partners for response need and collaboration opportunities, and also to provide training for individuals and communities and government and response actors where it was needed. So loads of different activities taking place there. The active COVID-19 response happened in 33 countries, and we were on standby to work with 15 more, which are now those 15 are now being actioned. So we're working in more than 33 countries now, and you can see on this map where HOT led the activities, where community led activities, and where our microgrant recipients were acting as well. So in terms of achievements, what our community has been able to do, or what the community has been able to do, is a large amount of remote mapping. So this COVID-19 response was the largest response in terms of contributions, with over 22,800 mappers contributing to almost 4.6 million map features on the hashtag COVID-19 Tasking Manager project. This includes nearly 4.1 million buildings and over 100,000 kilometers of roads. And we've included lots and lots of health infrastructure data. So, and most of the, well, in fact, all of the communities that will be presenting today will be talking a little bit about that. We're extremely delighted because the validation has almost kept up, kept up with the mapping. So we had paid validation support previously, yeah, even though there's a high number of tasks, we've got lots and lots of support from other validators within the HOSM community, as well as the partners that were specifically working on that. And the averages across the project, so 82% of the projects that have been mapped, of which 60% have been validated. So we're still doing pretty well considering, considering we've had such a vast amount of projects for COVID-19. Other achievements to note, up to 24 scenes were uploaded from Maxar's Open Data Program to Open Aerial Map. So this community was available for OSM mapping, which is fantastic. And the amount of corporate mapping coordination we've done as well has been great. So we've had lots of key partner representatives to really help with the development of the pipeline to make sure that we're supporting the communities in that are operating on the ground. The achievements of the Rapid Response Microgrant Program, which was the COVID-19 microgrant program we ran, we had 7 communities that were awarded around $5,000 each. These include iLab Liberia, OSM DRC, OSM Senegal on health sites, Public Lab Mongolia, MAP Uganda, and humanitarian mappers from Nigeria and MAP Kibera from Kenya. Only 6 of the 7 projects have completed. We've still got one that's still going. But of those 6 projects, 36 training events have been hosted by the microgrant recipients, and 396 individuals have been trained by the microgrant recipients as well. So really incredible numbers. 125 new community members were brought in, 28% of those were women. So yeah, making strides for sure. Okay, so in terms of the contribution that those microgrants partners have contributed to OSM, microgrant partners have made over 1.9 million edits, added 9,716 COVID-related POIs to the map. So that includes health facilities, it includes pharmacies and quarantine centres, also kind of larger things like you know, schools, community centres and things like that, where COVID-19 activities are happening, and we'll hear a bit more about that shortly. 14,000 kilometers of roads have been mapped, and over 270,000 buildings have been put on the map. So really incredible progress. So now I would like to hand over to Carter Draper from iLab Liberia, who will be talking about the project that he implemented in Liberia. Over to you, Carter.
Thank you so much, Sophie, and good morning, good afternoon to everyone. Do you want me to share my presentation?
Yes, please.
Share that. Just a minute. Okay, I'm Carter Draper. I'm the country director for iLab Liberia, a local tech hub based out in Monrovia. So in March of 2020, Liberia experienced the first case of the COVID-19. By May, the cases have increased over 100. And iLab Liberia being a local tech hub, and from our experience of supporting crisis management in the past, the Ebola virus disease in Liberia, We thought that we could be able to support central government, especially after identifying issues with limited resources and lack of adequate awareness around the coronavirus. And so with support from the Humanitarian Open Street Team Award, awarded ALAP a macro grant. And that macro grant enabled us to map functional healthcare facilities, COVID-19 facilities, and cases across Liberia. We developed several products that were generated into various open data formats for ease of use by different partners and institutions. The data sets were published on uploaded to OpenStreetMap and shared online for everyone to access. The project was implemented in 3 months using like 7 remote mappers. At the beginning, by the time we were starting the project, the country had just emerged from the state of emergency, but then there was still this lockdown. And so we had to work absolutely remotely, but we're still able to online engage our stakeholders. And we engaged the National Public Health Institute of Liberia that provided us with periodic cases, a number of cases on the COVID-19. We engaged the Ministry of Health that provided us a data set of functional and not functional health facilities across the entire country. We engaged the Ministry of Public Works that provided us with data sets on rural connectivity across the country. We engaged with the LISGIS, Liberia Institute of Statistics and Geoinformation Services, who provided us with shapefiles and other geodata that enable us to do adequate mapping. Other stakeholders were the Medical Teams International, Last Mart Health. Preview is a research institution that is looking into the causes of Ebola and this treatment. We also engaged with the Johns Hopkins communications team here in country. We engaged with the World Health, it's a German entity also supporting health services in Liberia. We engaged with the county health team. So across the 15 counties of Liberia, there are county health teams per each county, and we also were able to engage with them adequately. Then, of course, we reached out to both online and offline researchers, reached out to some universities, students, and of course, the general public. All of these were done online with a minimum face-to-face engagement. How did we get it done? We definitely worked from home. All of our remote mappers were working from home. After assessing the data that were presented us, we did an in-detail assessment of the data sets as to how relevant it was for the kind of work that we needed to do. We also conducted a remote mapathon as part of recruiting remote mappers. And that was the very first online mapathon that we ever conducted, which was also conducted via Zoom. We had up to 21 participants on that mapathon, through which we were able to recruit 5 remote mappers. We then went into the data cleaning process, and that data cleaning process also tied in with our data model. With the data model, we were kind of a bit ambitious. We wanted to include more detailed information across health facilities, but with the lockdown and after an effort of reaching out to a couple of administrators, we felt that we couldn't get a unique information across all health facilities, and therefore we could not include information like number of beds and number of doctors and so forth. After that, we did a refresher training in the specific tools with our team of remote mappers to get things done. And then, of course, every step along the way, we updated our stakeholders. The data generator, we were able to publish the data online. We created awareness using social media and other postings. We were able to also share the product data with different stakeholders via email. So we have 5 remote mappers on this project. Internet was a challenge because we're working from home. So the little we got from the macro grant, significant portion of that went towards that. So we also worked with the tasking manager, in which we created 35 tasks across the 15 counties, both for COVID-19 facilities as well as for the functional health facilities. We used the JOSOM editor to work out and be able to map both tasking manager and the JOSOM to be able to conduct the remote mapping. We also got imagery from the open area map that we kind of added to each of our tasks in the tasking manager. We use QGIS to develop printed maps that were now developed and kind of distributed to county health teams. We use the Google Sheets for proper coordination and so on. So the data sets that we developed under the macro grant were into CSV formats, into JSON formats, into shapefiles. We also had a raw data set into XLS so that other developers and other institutions can follow up and mine our data. And we generated up to 15 paper-based maps, 4x8, that we distributed to the county health teams. So the image shown there is our website that contains all of these data sets in addition to posting them or uploading them to the OSM. The impact. So for the impact, we were able to, under health facilities, we mapped 24 hospitals across the country, 750 clinics, 20 health centers, 1,305 confirmed cases by the end of August 2020, and now we are updating the instance to include it to the 1,036 in January 2021. For the COVID facilities, we mapped 10 schools that were used as testing centers and quarantine centers, 9 hotels for quarantine facilities, 1 sports stadium, and 1 research facility. Our products were developed into data sets that are currently residing on OpenStreetMap. We developed 2 embeddable digital maps that are currently on our own website. We developed and printed 20 printed maps. We had 5 data sets in various formats. We had 1 embeddable infographics of COVID-19 cases. We had 1 embeddable infographics of healthcare facilities across the country. So the product distribution channels were onto the OpenStreetMap. There were we using the JSON as well as the tasking manager. We uploaded all of that data onto the OpenStreetMap. We also have all of this data into a repository onto our website. The link is also in this presentation. We also emailed kind of the data sets and the products, we kind of compile them and email them to all of the key stakeholders. And then we ran an entire social media campaign for about 2 weeks, pushing all of this data into different social media groups, both on Facebook as well as on Twitter. And then we had an in-person presentation of the maps to the 15 county health teams in Liberia. So that's it for us. This project was a real huge insight and benefit for the people of Liberia. The last time we checked our website, there's a real good indicators that different stakeholders and researchers are actually accessing and downloading these data sets to repurpose them for their own work. Thank you.
Fantastic. Thank you so much, Carter. And yeah, that was a really, really great presentation. I love the infographic at the end there. Awesome. So does anyone have any questions for Carter?
Hi, Carter. Mark Herringer here from HealthSites. Congratulations on this work. I'm interested in the data you got from the Ministry of Health. We made a request a couple of years back for the data, and if you've managed to get the health facility list shared to OpenStreetMap, that's a huge achievement. Could you tell us more about that? Over.
Yeah, so the culture of open data in Liberia is a really huge thing. There are a lot of data on Liberia, but they are all very shallow. And so we had to really engage at the top level. But one of our successes actually didn't come from the current engagement, but over time from the Ebola virus disease that we extensively worked with the Ministry of Health, had kind of built that relationship with us. Notwithstanding, the data that they actually shared with us was more like redacted because they had to take out a lot of other information that they thought that, well, it's quite sensitive and we cannot share it with a third party. And that was one of the main reasons for which we could not get added information to kind of extend our data model. But yes, at the top level and with our own working experience with the ministry, I think they were quite helpful in that regard.
Great, thank you, Carter, and thank you, Mark, for that excellent question. Carter, there's a question from Willie in the chat, which says, how do you experience the quality of the hot mapping done by worldwide mappers?
Yeah, I mean, so prior to this rapid response, we also have worked with Hot Direct on a couple of projects. In Liberia, we have an open mapping network that comprises of youth mappers, OSM Liberia, and Alab community of mappers. And so we think that OpenStreet, the community as a whole, is doing an extremely good work. And with the level of validation that, you know, the layers of validation that has been currently in play for data that feeds onto OSM, I think that is really kind of creating a more reliable set of data sets that a lot of partners can rely on. Outside of this project, like the Red Cross in Liberia, LISGIS, and the National Disaster Management Agency of Liberia, including the City Corporation, they think that, you know, the OSM data is quite relevant, and it helps to improve and enhance their work. But one major challenge we have in Liberia is updating and keeping the data live over time. So with our own open network members, with the limited resources or lack of resources, we kind of are often quizzed and challenged as to what is the reliability of the data, how often is the data updated. And so I think part of our engagement with the humanitarian OpenStreet team is to see how we can empower not just the Liberia team of mappers, but at least at the level of every country to be able to have, whether it's through a macro grant or through some other program, to enable these community mappers to continually and routinely update data onto OpenStreetMap. But overall, I think the culture of open data has been an issue in Liberia, but we are, as pioneers, are working strongly and encouraging different stakeholders to kind of see that open data is the way forward, because it helps to kind of speed up development and kind of speed up response.
Yeah, fantastic. Willie responded in the chat saying, I asked the question because the quality of the imagery does not allow us to do precise work. Is that a problem for you? Which I guess you just kind of almost sort of answered. Yeah.
Yes. So to speak to that, yes, definitely, yes, a big yes. We had an issue experience with the imagery, was because it was not quite updated. But we can say that we kind of got over that barrier fully, but to an extent that our remote mappers are also from these different counties and many communities, they were able to also kind of use the coordinates on the coordinates that were associated with the facilities as well as the terrain to be able to adequately identify those facilities. So yes, the image was challenging, but yeah.
Great. And then we have another question from Laura in the chat as well, asking, was there a larger team contributing, or was it just the 5 remote mappers?
Yes, so we had a core team of the project of 4 persons, plus the mappers, plus the 5 mappers took us to 9 persons. We had 1 supervisor that was directly supervising the mappers, and the 4 core teams were more into validation, of which we also had some extended support from anonymous contributors into our validation processes as well.
Yeah, great. Thank you so much. Okay, thanks for your questions, everyone. If anyone does have any other questions for Carter, then please feel free to reach out to him, but also hang around for the networking session afterwards. So if anything comes to you over the next couple of sessions that you want to ask Carter, then save that for the networking session at the end. Okay, fantastic. So let's move on to Public Lab Mongolia. Ed Escott, would you like to share your screen?
Okay. Can anybody see my screen?
Yes, we can.
So hello everyone, and I'm Erden Zagt, and the Executive Director at Public Lab Mongolia, and it's a great pleasure to join today's session. And also I want to say very special thanks to HOT team, and also very special thanks for support from HOT team and Geoffrey, Sophie, and Russell, and the rest of the team guy. And okay, let's start my slides. Yeah, this is a very brief introduction of our organization. And the Public Lab Mongolia is very local civil society organization. It's a fairly young organization established in 2018. Now the teams consists of young professionals interested and passionate about environmental issues and community development and mapping. And our mission is to cultivate healthy environment and resilient communities through open data. And also we have core programs in our organization, Mapathon and youth education and community science. Yeah, on the Mapathon program, we are trying to build a network of local mappers and also promote OpenStreetMap and the use of geospatial data here in my country, and also support the data-based decision-making through developing the OpenStreetMap in my country. Yeah, next slide. How COVID-19 response microgrant supports in Mongolia, and OpenStreetMap is a critical tool for national agencies, national COVID-19 response agencies and local authorities and civil society organizations and research and business and the public sector. Yeah, this slide just shows you how Mongolia looks on OpenStreetMap. You know, it's a very urban area. It's only the partially mapped and needs to more mapping activities. And semi-urban area, it's also partially mapped. And the rural areas are also mostly unmapped. And you can see the photo of how it looks like settlement, different kind of settlements in my country. Yeah, this is the map of completeness of OpenStreetMap, and the blue ping indicates the partially mapped, and the purple ping is still unmapped, but it's very suburban centers, but still we need to more mapping in this area. And on this COVID-19 response microgrant, we have been organized 15 different trainings and mapathons on OpenStreetMap. And also we have created and mapped 22 projects. And this is the location of where we have mapped. And the total number of participants on all these events, 145 participants. And we have mapped 144,000 buildings and 5,600 kilometer roads, and the total it's 1.5 million edits on OpenStreetMap. And most of the OSEM Mongolia community is mostly the beginner mappers and the young people, university students and GIS professionals. And we don't have not enough validators at this time, and we need more validation activities in the future. So on this micro grant project, we also have initiated the COVID-19 community mappers program. It's also a remote internship program. We have selected 21 participants from 21 provinces, and we have done mapped with we have organized the data collection around the health sites, and also we have organized data collection for essential service in terms of COVID-19, and we have used the Survey 123 for health sites. Reason why we use the Survey 123 on this project, because we need to collect all the health site data by local because we have to check the data quality, and once we have checked the data quality, we have to upload it into OpenStreetMap. It's now we are still working on the data quality and the validation, and this part of the event is we have created a number of essential service lists, and then we have asked the internship participants to collect all the essential service data on OpenStreetMap. And it's okay. Next slide. We can see the how many data and how many hospitals and pharmacies that we collected on during this internship program. Yeah, we almost 900 hospitals and clinics, and almost 800 pharmacies around 21 provinces and 330 sub-provinces. Yeah, this is the one of the group photo. We call it group photo because it's all the events and activities are organized by remotely during this pandemic time. And this is our internship. And also we call community mappers from 21 province centers. And this map is, I like this kind of this map because when we work on OpenStreetMap, there is a little light, shining, and I'm very happy to see this kind of interpretations. Yeah, and also we have during this project implementation time, we also very close work with the National Emergency Management Agency. It's a government agency, and we work with them very closely, and mostly they work on the data validation. And yeah, most of the challenges we have faced on BaseMap is very outdated and blurry in the rural settlement areas, and our OSEM community is fairly young and inexperienced, and also lack of validation. We need more validation, and we need to train our active OSEM mappers to validation. Yeah. Okay, thank you. If you have any questions, please have ask me.
That was wonderful. Thank you so much, Edenisko. And
thank you.
You've already had 2 volunteers from the chat, Derek and Nick. Thank you so much for
thank you.
flagging yourselves as expert validators that can come in and help the community. So perhaps we can convene in the community working group and I can introduce you all. Awesome. So does anyone have any questions?
Sophie, I've got a question with regards to the validation.
Sure, go ahead, Mark.
That you've just referred to. what's the nature of that validation? And I suppose what I'm asking about is, are the validators people who are working in a health facility in Mongolia and can confirm the services available? Or are the validators validating the data in terms of semantic correctness? Over.
Yeah, it's a one group of validators needs to check all the health services in Mongolia, and the other way we need to improve the beginner mappers. You know, the beginner mappers map all the locations, and we need to improve their you know, mapping elements, because when the beginner mappers, it seems the quality and its inconsistencies, it seems not enough at this time, and we need more validation, and I mean we need to qualify the data in OpenStreetMap.
Yeah, absolutely. And, you know, I mean, this is a common challenge that we've all got. And from our work, you know, the work that I've been doing over the years, it's the best way is to validate the data is for local people to be using it in their daily activities. And so, yeah, I think there's a real opportunity as the data improves for local entrepreneurs to make use of the data to support health outcomes on the ground. Over.
Yeah, you're right. Yeah, that's why we initiated the OSEM Community Mappers program, and this aim of this program is to bring the local people together to improve and to increase the attribution of OpenStreetMap data, because we don't know the every places in, you know, we need also collect more attribute data. Yeah, absolutely, you're right.
Great. Okay, cool. So does anyone have any other questions?
Oh, sorry, I have one more things I want to mention about the base map. Like we have a different kind of satellite imagery, you know, beam maps, Esri and Maxar, and all these base maps are different georeference, you know, georeference. Yeah. It's really, you know, inconsistent, like they have huge difference between the georeference and because our OpenStreetMap volunteers and teams are fairly young, and they I don't know, it's mostly they ask us can we or maybe raise that kind of georeference issue to, you know, more higher level of OpenStreetMap, or I don't know. It's a really big challenge for the beginner mappers at this time. And yeah, there is a function to how to say improve the georeference, but the beginner maps also cannot do that kind of technical things on this at this time. Yeah.
Yeah, great. Thank you so much, and really great project. Congratulations. And if anyone wants to get in touch with the Public Lab Mongolia team, then please do so. And let's see if we can help out with that training, getting together some great imagery to help out the beginner mappers a little bit. Okay, cool. Okay, so let's move on. Thank you, Edna Scott. Let's move on to Lamine, who will be hosting on behalf and presenting on behalf of OSM Senegal, whose project was in collaboration with Mark Herringer at healthsites.io. So Lamine, would you like to share your screen? Fantastic. Oh, thanks, Mark. Cool, we can see your screen and we're ready to go. But Lamine, if you're speaking, we can't hear you.
Hello.
Hello.
Hi, Sophie. Excuse me. Okay.
Sounds like you're in a busy place, Lamine.
Okay. Mark is here. Mark, you can start, please. At the beginning. Okay. Donc, I go to make my presentation in French. My English is not very fluently. Apologize for everyone. Donc, je m'appelle Mohamed Lamine Ndiaye et je suis membre fondateur de la communauté OpenStreetMap Sénégal. Et je travaille avec Mark Herringer sur un projet de cartographie donc, concernant les structures d'urgence, donc HealthSite. Donc, Mark, you can start in English.
Hey guys, okay, thank you, Lamine. Mark Herringer here. I run the Global Health Sites Mapping Project, and Lamine and I have been collaborating since 2017 to improve baseline health facility data in Senegal. And it's a pleasure to be presenting the work, and thank you very much, Sophie and the team at HOT, for all the support that you've given us. The collaborators in this micro grant have been fabulous, and I've just put a QR code here that'll take you to the page if you want to get in touch with any of them, and there are social media accounts and what have you underneath their name. So please go ahead and do that. So one of the primary things that we're focused on is understanding the application of human-centered design and how it can benefit from the data that we're improving. So how can we put the user in the driving seat with regards to the data and as it improves? So what are the primary user stories that people need to be addressed? And this is our strategy, is to take those stories and with them identify the most important attributes in health or in the OpenStreetMap baseline health facility data and improve those. And then we've obviously got an open source platform on GitHub where we invite you guys and the community at large to tell us what's the most important features and functionality you would like to see on the platform. It's an open development initiative. And so, you know, we're a global good that's been funded out of Digital Square. We're a digital public good that's been identified by UNICEF. So this is a resource for the community to take advantage of and use to drive the development of the data. So the reason we are focusing in specifically on emergency health data is as a result of this report that came out a couple of years ago by the Khemri Wellcome Trust, who pulled data from Google, PDF files, people's hard drives, ministries of health, from as many different sources as they could get hold of. And they established this database, and they said, look, we've got all these facilities, but out of the 4,908 public hospitals, we can't tell you what the emergency services in these hospitals are. And this is the priority. And so that is what we're focused on doing, is improving emergency health data. Now, with regards to the stories, we try and take a very structured approach to the sentence. So we use the persona and we describe what they want and why they want it. So as a pregnant mom preparing for birth, I would like to visit a facility with an ultrasound so that I can give my baby the best care possible. And then as an epidemiologist, I want to know the number of hospital beds at a health facility so that I can assess the capacity to manage a disease outbreak event. So we've got two different personas there. We've got the pregnant mom and we've got an epidemiologist. And as a result of that, these user stories, we've identified the ultrasound and the hospital beds as being the attributes in OpenStreetMap that we want to improve. And in addition to that, when we are telling the story to people and running campaigns, we can work directly with people on the ground through these sentences that everyone understands. So that QR code will take you to an emergency health page, which you can collaborate through. Here's the baseline that we've established with OpenStreetMap. As you can see, it's relatively small. The International Hospital Federation gave it to us when we launched with the ICRC following the Ebola outbreak a couple of years back, or 2016 to be precise. And they said, look, these are attributes that should be in the public domain. And we've matched OpenStreetMap with these attributes. And as a result of that, established a baseline in OpenStreetMap. So each facility has a unique URL that you can use to share, and the form allows you to update baseline health facility data. Okay, so there's the method that I wanted to communicate to you before we get into the microgrant and the work that Lamine has done with the team. I wanted to just explain to you the human-centered design approach and how we can use it to drive baseline health facility data. So, you know, here's the diagnostic radiology you can see, and as a result of that, people begin to access services. So our colleagues at HiGet are able to generate isochrones and distances to travel to get to a particular service. And as the data improves, these are the applications that are now available. And so Carter and Egershot, you know, your entrepreneurs, taxi drivers, and various other people in your communities are now able to take advantage of this data and actually use it to offer services. And I think putting a user story up front to understand what's going on is really important. Okay, Lamine, over to you.
Ok, merci Marc. Donc, je vais juste parler en fait de ce qu'on appelle la data collaboration qu'on a eu à faire en fait. Au début, on a démarré avec les gens du ministère de la Santé, donc au niveau de Saint-Louis, où avec le Dr Ndiaye, on a pu identifier en fait toutes les structures sanitaires sur la commune de Saint-Louis. Donc, et là, grâce à la collaboration entre OpenStreetMap Sénégal, HealthSide, Kato ONG et Geomatica, on a pu collecter en fait un ensemble de données donc, sur les structures sanitaires, donc des informations sur le nombre de lits, le nombre de médecins et le nombre de ultrasons, mais aussi le nombre d'appareils respiratoires. Donc, next slide, please. Donc, tout ça, on a pu après faire un compte rendu de ce travail-là au niveau du bureau de OCHA, donc avec Ahmadou Ndong et Ahmadou Diko. On a pu réunir tous les acteurs, donc des ONG qui gravitent autour de la santé, mais aussi des acteurs qui sont là pour pouvoir voir dans quelle mesure, en fait, ces informations-là vont être utilisées pour lutter contre COVID-19. Next slide. Donc, ce travail-là aussi nous a permis un peu d'aller briefer l'équipe de Dr Youssouf Ndiaye, donc qui est au niveau du département de la planification et de la recherche et des statistiques du ministère de la Santé. Parce que aussi, il y avait ce soutien stratégique-là que nous, en tant que communauté, on a pu apporter en fait au ministère de la Santé pour un peu répondre à la lutte contre la COVID-19. Next slide. Et il y a aussi un processus de validation en fait de ces données-là. parce que avec le centre des opérations d'urgence que docteur Bousso dirige, donc on a pu en fait avoir une baseline qui nous a permis un peu d'aller sur le terrain et de collecter l'information. Et cette information-là, une fois collectée avec Kobo Toolbox, ont été remis au format CSV au niveau de passe et de course pour qu'ils puissent valider en fait. Et cette validation-là nous a permis un peu, une fois terminé, d'aller avec GeoSem, éditer la donnée et le mettre sur la base OpenStreetMap et sur la base donc de HealthSite. Next slide. Donc, it's over for me.
Okay, thank you, Lamine.
Thanks.
Okay, so the microsite that we've established is available here, and as Lamine was saying a moment ago, you know, the validation process with the disease outbreak unit and PATH is an essential piece of work that is continuing, and is really a space that I would invite you all to follow, and we will try and share updates with regards to, you know, exactly how that validation method is moving forward, and how PATH and the Ministry of Health and the Disease Outbreak Unit are validating and collaborating with OpenStreetMap Senegal to improve baseline health facility data in Senegal. So the validated, or sorry, the map has collected 104 locations, and here are some of the statistics that they updated to OpenStreetMap. And Lamine and the team essentially improved some really key user stories that I was referring to at the beginning of the presentation, and bed data is one of them, and our partner collaborating in the project, AfriMapper, have generated these data visualizations which show, you know, the bed data prior to the mapping was concentrated predominantly in St. Louis, which is just north of Dakar, and now following the update, you can see a much better representation of the beds in the country. And this is a really important information for epidemiologists to understand, okay, if we've got a disease outbreak in this part of the country, what's the capacity to manage people presenting with the disease, and understanding the number of beds in facilities is one of the ways that is done. So Highgate, we're also working with us on this, and they've presented this visualization. You can see in the red is what we had prior to the mapping and the data update, and the green is what has come in following the update. And then emergency care has been extended into all the yellow areas. So, or should I say, we've able to put data into OpenStreetMap, which presents the emergency care currently available in Senegal to the best of our knowledge, and this represents the best of our efforts to date. So, you know, if you, for instance, are an entrepreneur looking to provide a taxi service or an ambulance service, this would potentially be a good asset for you to assess where you should work. And then in addition to that, from the Ministry of Health's perspective, it gives them a good idea of how to support those entrepreneurs in places where potentially there's a subsidy needed because the market is very small. Okay, so just going back to the health site's key activities, we're supporting organizations to share health data into OpenStreetMap. We're looking to build the collaboration between the communities and the national agencies. We're building higher quality data in the form of a location validation index, which is available through our roadmap on the GitHub. So understanding whether the users are trusted or not, when the update was made, how many of the attributes have been completed. These are elements that we're looking to develop, and so people can get a sense for how valuable or how up to date and rich the data really is. And then finally, encouraging people in the communities that we're trying to serve and where we're looking to improve the quality of the data, for them to tell us what are the most important user stories that you want us to address. Is it about maternal health? Is it about snake bites? Is it about car accidents? Is it about cataracts? What are your stories? Tell us what's important to you. Share them so that we can prioritize them with you and improve the data that's underlying them. So health sites can support campaigns and work with you to establish your data collaboratives, as Lamine was describing earlier, and we welcome the opportunity to do that. Finally, we're part of a COVAX response group, and this QR code will take you to that page. And essentially, we're looking to improve the data where it's currently lacking and support the COVAX rollout. Okay, thank you very much, everyone. Lamine, do you have anything to add, or? Yeah.
No, it's good. Thanks.
Okay. All right, guys, we'll open the floor to some questions then. All right.
Great, thank you, Mark. Thank you, Lamine. Just a note and a nod to the request in the chat. Yes, we can absolutely see if we can get some subtitles added to Lamine's fantastic talk later on. And there's also a blog. The blog that I posted in the chat here was from the pilot, which is where this idea kind of originated. But perhaps, Mark, you could share the microsite in the chat so that everybody can have a look at that. That would be most helpful. Does anyone have any questions for Mark and Lamine?
I can see one question there with regards to some health services that are available locally don't have tagging for OpenStreetMap. How are you overcoming this challenge? The answer to that is by engaging the tagging community within OpenStreetMap. So, campaigning to have the tags accepted so that we can essentially publish the data to OpenStreetMap. And I'll just see if I can find that page exactly. I think you're referring to specifically staff count doctors, staff count nurses, and healthcare equipment. So this is exactly how we would move forward, is to advocate for it within the community. Does that answer the question?
Great. I'm going to take that as a yes, Mark. Okay, so we're actually reaching time. So I can see that there's another couple of questions in the chat, but I understand if anyone does need to drop and doesn't have the next half an hour, then please go ahead and do that. But before you go, please can everybody just take a moment to type in their name and where they're from in the Zoom chat, just so that we can get a flavor of who's here and the locations that you're coming from. So let's, I'm going to just take up another 3 minutes of the breakout room session because, Mark, you've got a question here from Davey, which is, hey, Mark, what are your next moves for health sites? What are your dreams?
Davey, dreams are definitely to visit you on the Canary Islands and potentially have a surf. No, the dreams are to establish a very powerful and strong connection to people on the ground so that they can take ownership of health facilities in their area and work with the medical community to improve the quality of the data and health services and essentially attack Sustainable Development Goals 3.8. Over.
Fantastic. Thank you so much, Mark. Okay, fabulous. So now we are going to move into breakout rooms. So there are 36 people on the call. We'll split out into I think around 3 to 4 rooms, and you will be kind of arbitrarily gathered together. So if you're not happy in your room, then come back into the main space, and then you can come and then you can join another group. But essentially, the breakout rooms are, you're still sharing your screen, Mark, just an FYI. The breakout rooms are an opportunity for you to collaborate, have conversations with, meet other people from OSM communities from around the world, and also to ask any questions to our wonderful hosts about their work. Before we go into breakout rooms, because I think when we come to the very end of the next half an hour, we'll probably all start to drop off. But I just want to say a huge thank you and well done to the 3 presenters today. Really wonderful work, and thank you very much. Big round of applause from everyone to the teams for their work. Okay, yeah, I can see some claps coming up. That's awesome. Thanks everyone. Okay, cool. So I'm going to put you into the fabulous hands of Ben Dills, who is who's in charge of the Zoom chat today, and our Zoom wizard. Ben, do you want to talk us through the process for coming into the breakout rooms?
If everything goes according to plan, everyone will be magically invited into a pre-assigned breakout room in just a moment. But it should still be possible, if you would like to, for you to leave the room that you are in and choose to enter a different room, if that's what you prefer. So I will hit the button in just a moment.
Great, thanks everyone. So we probably will convene again at the end if you're still here. But yeah, looking forward to seeing you all in the rooms. Please feel free to join the breakout room you've been assigned to. Welcome back, everybody. Okay, fantastic. So I think everybody's probably heading on back. Yeah, awesome. Okay, so we have 1 minute left. Thank you all so much for joining and for your participation. Big thank you to the speakers today, and also a massive thanks to the community working group, who are just not only an absolutely fantastic community, but also wonderful people. So if you want to get involved and meet everybody, come on over, join the community working group. And yeah, Courtney has just posted in the chat, we have another webinar on the 26th of February. It's about colonialism in open mapping. And I have one last request, which is, you all heard from microgrant recipients today. We have another round of microgrants that are closing on Sunday, and we are looking for people to respond, endorse, give feedback to those proposals. So if you have time and you want to read about some other fantastic projects that may be kicking off in areas that you're operating in, then please have a look at the link that I just posted here in the chat. And as Jika just mentioned, here's the link to joining our community and our working group. So it's the HOSM Slack channel, and look for the channel community-WG, or you can email community@HOTOSM to get involved and touch base with us all. Thank you to everyone. See you all in the webinar in the next couple of weeks. And yeah, congrats everyone for your awesome work on COVID resilience.
Thank you.
Thank you, Sophie. Thanks for all your support.
Oh, you're welcome, Mark. Thank you. Speak to you soon. Great. Bye, everyone.
Bye.